All right, welcome everybody. We're going to get started. Welcome to this webinar on COVID responses, supporting learning, equity, and resilience, day 2. My name is Anna Maria Tammy, and I'm the thematic lead for equity and inclusion here at GPE. I'll briefly go through the agenda for today, and then we'll get started with our first session. So today we will have 2 thematic sessions. The first of them on equity and inclusion, looking at lessons around reaching the most vulnerable children, including girls, children with disabilities, and children living in conflict-affected countries, as well as supporting the return to school for all children. The next session after that, we'll look at adaptive implementation, considering findings around adaptation, continued relevance, as the pandemic evolved, as well as resilience. We will be ending the day with a few closing remarks from Rafael Martinez at GPE. Just a few logistical points before we launch in. So there is interpretation available throughout the event in English and in French. You can find the language options at the bottom of your screen. By default, you are on the main floor and you are going to hear interventions in the language which they are spoken in. So if you would like to hear everything in English or everything in French, then please do make the selection accordingly. There's also a question and answer box where we encourage you to write any questions or comments that you have throughout the sessions. Panelists are going to be able to answer them in writing, and we'll also allow time for verbal responses where time allows. We're going to be recording this webinar, and it will be available in due course for anybody who can't stay the whole time today, or any colleagues that you would like to share with later on. So without further ado, we're going to get started with the equity and inclusion session. So I am pleased to present here our speakers. I will go through them in just one moment after I introduce a little bit the topic of this session. I will just stop sharing my screen for a minute here. All right, so in this session on equity and inclusion, as I mentioned, we're going to be looking at reaching the most vulnerable during the pandemic. We know that during the pandemic, the most vulnerable and marginalized were the hardest hit by school closures, with many never returning to the classroom. The pandemic really exposed and exacerbated educational inequalities, including gender inequalities. And in addition to the profound learning losses, school closures negatively affected children's well-being, including reports of worsening nutrition due to missed school meals and increased feelings of anxiety. In this session, we'll hear country and global perspectives on the impacts of school closures on the most vulnerable children and what worked to reach these children during the pandemic and promote their return to school. We will also reflect on what we know about the negative effects of school closures on children, particularly the most vulnerable. It's our hope that by examining these lessons and promoting their take-up within education planning and implementation, we can ensure that our collective responses to future crises lead to better education and well-being outcomes for children. So I am very pleased to introduce our esteemed panel. First, we have Charles Karakie, who is the Permanent Secretary of the Ministry of Education of Rwanda. He has over 18 years of experience in economics and government administration. Prior to his current position, he served as the head of Government Action Coordination Unit and as an economic policy analyst at the Office of the Prime Minister. His experience also extends to the Ministry of Finance and Economic Planning, where he made significant contributions as the budget execution officer and later as a budget planning and execution expert. We're so pleased to have you, Permanent Secretary. Then next on my list is Rob Jenkins. Rob, I wonder if you are here. If so, can you turn on your video, please?
I see Rob in the panelist. Yeah.
All right, so Rob Jenkins is the Director of Education and Adolescent Development at UNICEF. He joined UNICEF in 1995 and brings over 20 years of experience in international development and humanitarian programming in Africa, Asia, and the Middle East. Next, we have Professor Donald Bundy, who is Professor of Epidemiology and Development at the London School of Hygiene and Tropical Medicine. He's director of the Research Consortium for School Health and Nutrition, and advisor to the UN World Food Programme, leading a global research effort to provide evidence-based guidance to the 90+ member states of the School Meals Coalition. We then have Julia McGowan, who is the head of Inclusive Education at Humanity and Inclusion. Together with 3 colleagues, she oversees over 50 inclusive education projects across the world in 26 countries. She is co-chair of the Inclusive Education Working Group in the GLAD, Global Action on Disability Network, together with colleagues from UNICEF and GPE, and is also a coordinator of the Inclusive Education Task Group in the International Disability and Development Consortium. Next, we have Emma Sarton, who is a senior education advisor with Cambridge Education and is the learning lead on the Girls Education Challenge. Emma has carried out numerous evaluations of education programs, and in her current role, she curates implementation evidence around interventions that successfully support positive outcomes in girls' education. And I think that's it for our panel, unless we have our UNESCO participant who has joined, but I don't see them. So unfortunately, I think UNESCO needed to drop out. So with that, I will hand it briefly over to Lorenzo Newman, who you will have heard if you've joined yesterday. And he was one of the evaluators who looked at GPE's COVID support. So he will share a few findings about equity and inclusion in particular. Over to you, Lorenzo.
Thank you very much, Anna Maria, and thanks all of you for joining today. It's still a pleasure to have the opportunity to share these findings with you all. What we're going to focus on today are the equity outcomes reached across the accelerated facility grants funded by GPE during the course of the COVID-19 pandemic. So across 66 partner countries. I think the headline here is that the screening process throughout granting allowed many of the grants to focus on equity aspects. 40% of them accounted for AF grant budgets. Now, when we look at percentages of funds allocated to equity activities, by far the largest components were marginalized children's and well-being programs. 13% of mitigation funding was directed towards this, and 26% of recovery funding was directed towards equity-related activities. And I think that's really key, just seeing how it's perhaps easier to fund equity as a recovery mechanism rather than as a mitigation action when the pandemic is evolving so quickly. Like I said, screening criteria really helped ensure this was part of granting. During the application process, the quality assurance team had a dedicated member to make sure that an equity dimension was included in each grant proposal, despite the high speed at which those applications were processed. One issue was that there was no measurable criterion in the screening process. So the question was, does the program to a sufficient degree reach poor, vulnerable, or otherwise disadvantaged children, including girls? So that was not always measurable during the evaluation process. But like I said, all accelerated facility grants, even if they did not explicitly target equity, at least included some activities addressing the needs of vulnerable groups, and in particular girls. So what were countries actually doing? I think one aspect to focus on in terms of gender was the disproportionate impact of WASH activities. So something we said yesterday was how some of the simpler, less experimental interventions were often the most effective. And I think WASH is a good example of this. Countries such as Mozambique leveraged the WASH aspects of their grants to go one step further. For instance, distributing hygiene kits for girls, installing telephone lines to report cases of abuse at home, and providing psychosocial support training for teachers. Psychosocial support was actually one of the activities likeliest to reach its targets across the portfolio of grants, with some of our case study countries, including Bangladesh, Cameroon, DRC, Mozambique, and Nicaragua, reaching or exceeding their targets. It's always good to provide a headline number. Over 59 million children were reached through awareness-raising campaigns. And 8 out of 10 of our case study countries highlighted the potential impact of sexual exploitation. We saw an emphasis on safeguarding mechanisms being applied across grant activities in the DRC, Congo, Ghana, and Micronesia. Who was reached? 82% of grant completion reports highlighted that children from remote or hard to reach areas were reached. Cameroon was able to do this by distributing tablets, for instance. And that's not an easy result. Of course, gender is not the only dimension of vulnerability, and remoteness is one that's often forgotten, but was really key during the pandemic. 56% of grants explicitly targeted and reached children with disabilities through at least one grant objective. At GP's request, Mozambique was able to achieve this by distributing textbooks in rural and remote areas. I should also highlight some other countries that exceeded their targets. Pakistan reached over 35 million children. Tanzania and Zanzibar reached 4 times the children in their endline targets. Cameroon was able to exceed targets by using songs, contests, and posters, encouraging over 4 million children to return. So really, the awareness-raising component, like I said, was quite effective. Briefly, I'm going to circle back to data limitations. While the screening process ensured all grants included an equity component, data on the effectiveness, so whether there's vulnerable groups, was reported on to different extents by the grant agents. 5 out of 10 indicators asked for disaggregated data by household income group. Only 27% of grants reported on indicators disaggregated by disability, and roughly 5 to 10% by ethnicity, and 5% by household income. So what this means is that overall indicators across all grant activities weren't always disaggregated by gender and other factors of vulnerability. And I think moving forward, there's a need for more beneficiary assessments, more measurable granting indicators at the start of the process. But overall, this represents a step forward compared to previous granting efforts where there hadn't been such stringent criteria. I've gone over time, so I'll stop here.
Thank you so much, Lorenzo, for setting the scene a little bit from the support to 66 countries. So we'll now zoom in to the experience of Rwanda. And so, Permanent Secretary, if I can start with you, could you share the experience of Rwanda on how you reached the most vulnerable children during school closures, as well as promoted their return to school? And we're interested in what was particularly challenging about reaching these children, and how did the Ministry of Education overcome this?
Thank you very much. First of all, in Rwanda, as in many other countries, the COVID pandemic disrupted almost everything, including the education sector, because on the 14th of March 2020, the first case of COVID-19 was noticed in Rwanda. And the following day, the government of Rwanda announced the closure of all the schools, from pre-primary to higher learning institutions. Then schools remained closed for almost 8 months, from March to November 2020. And of course, this affected the learning of 3.5 million children. Although all children were affected by the school closures, the marginalized children, particularly those with disabilities, and those children from poor backgrounds, orphans and girls, were most severely affected. This, of course, was due to the circumstances in which they live in, or due to their physical and mental conditions, which hinder their ability to learn at the same level as their peers without disabilities. Of course, Rwanda could not remain inactive and allow children to halt their learning. The Ministry of Education, with other partners, took every possible measure to ensure that learning continued for every child. And the first step was actually to develop a education sector COVID-19 response plan. This was particularly meant to address the equity and ensure that the marginalized children continued learning. In this regard, the Ministry of Education, together with the partners, prepared television and radio lessons, and these were broadcasted on Radio Rwanda and other community radios. So the TV lessons were also that were inclusive, incorporated sign language to ensure that deaf learners were not left behind, while the children with visual impairments were able to follow audio lessons on the radio. In collaboration with the local readers, the handout notes in Braille were distributed to students with visual impairments at their homes, while radio was also utilized to broadcast lessons designed for parents with learners with intellectual challenges and autism, educating them on how they could support their children at home. Similarly, for radio lessons, teachers would teach slowly, pronounce loudly, and repeat keywords or statements to support the students with learning difficulties. Particularly in total, we registered around 2,996 TV and 785 radio lessons, which were developed and aired, reaching up to close to 80% of the students. In addition to using the TV and radio, all lessons were uploaded to the free access learning platforms and the YouTube channels for Rwanda Education Board. Lessons were also shared with parents using smartphones through WhatsApp. For parents without smartphones, the text messages were sent to their phones to encourage them to support education of their children at home. And this was really to ensure that students could continue learning even after the TV and radio time at their own pace. Of course, there were very many challenges reaching out to the most marginalized, especially the limited access to devices such as computers, telephones, radio, and of course, limited to access to electricity, which made it a bit difficult for students from poor family backgrounds to follow radio lessons and TV lessons. Girls, of course, orphans and refugee students were even more disadvantaged. In addition to lacking devices such as radio and TV, these children were often occupied with also other numerous responsibilities, including handling household work to make ends meet during the COVID. And this made it even more harder to reach them for educational purposes. So the government is trying to overcome these challenges. The Ministry of Education, together with the Ministry of Local Government, private companies, and the development partners, tried to distribute radios and mobile phones to vulnerable families. And for instance, more than 5,000 solar-powered radios were distributed to such families. Campaigns that emphasized on the importance of remote learning were extensively conducted through various media channels, while regular follow-up and parental education on their responsibilities to support children education played a key role to ensure vulnerable students continue their studies. I think that's what the government tried to do on the challenges that we encountered during the COVID-19 for the education, and particularly for the marginalized children. Allow me, I will stop here for now. Thank you.
Thank you so much for sharing that experience of Rwanda, and it's very admirable what you were able to do in such a challenging situation. So we'll now discuss a little bit the global evidence and how these different experiences are resonating with what we've learned from other programs. So Emma, the Girls' Education Challenge is, of course, the largest fund for girls' education. And you collected a lot of evidence on what was working to improve girls' education during the pandemic. I wonder if you could share about what we know about effective interventions and policies for girls' education during that time and the uptake of this knowledge.
Hi, thanks very much. I see some people on the call actually who have intimate knowledge of the Girls' Education Challenge. So just really briefly, it's sort of a 12-year, £855 million investment focusing on marginalised girls in 17 countries. And it was implemented by 41 projects and 196 implementing partners, of which there are some on the call. And we're currently in the last phase, which gives us an opportunity to look across the whole portfolio and see collectively what we understand around kind of, I don't use the phrase lightly, what works and what doesn't work. We've collated lots of implementation evidence around what drives successful learning and other outcomes or hinders them. And much of what I say is encapsulated in a series of learning briefs and other materials we have, explaining how certain interventions can make the difference with insights on how to implement them effectively. It's worth noting now that actually the GEC approach to marginalization makes a very clear distinction between the characteristics of an individual and the barriers that interact with their identities. And in education, these barriers we know exist at the family, community, school, and system levels. And the process through which the characteristics and barriers interact, that determines the girls' social and academic outcomes and whether they're educationally marginalized. So that's important because in terms of what we know, that's where we were looking at the evidence. We know that projects that successfully maintained contact, learning levels, and subsequent return to education settings shared some common approaches and features. Moreover, many of these interventions or programming approaches have been continued post-COVID. While many projects like the rest of the world saw a pause in learning and learning losses, some projects, for example, in areas like in Kenya and Uganda, they actually saw faster rates of learning throughout the lockdown period. Now that was one or two examples, the rest was like everybody else. And I think because GEC projects had already worked hard to reach the most marginalized girls in their communities, they could focus their efforts effectively in three areas of access and retention, teaching and learning, and that psychosocial well-being and wraparound support that my previous colleagues on the call have already talked about. I've picked out 6 areas that helped achieve this success and continue to be the driver of the success after. Firstly, projects worked with and through communities. Because projects did this, they were able to focus their efforts very quickly on learning. They had excellent access to girls because they worked through grassroots organizations that were based in and staffed by people from the communities in which they worked. So the access to girls during lockdown allowed projects to distribute resources, follow up on potential dropouts, and support girls in having time to study, for example, many other things too. Secondly, projects used a mixed team delivery model, which was not only effective, but was kind of value for money. You know, community-based structures that can influence the education space do not only have to be those that traditionally operate within it. Projects were successful by going outside the usual suspects or structures that they were used to working in. By expanding their horizons and diversifying contacts within communities, projects tapped into the potential of non-education structures. So for example, in Kenya, looking at finance and health services, they use community health workers to reach girls and support their educational needs. Thirdly, there was a focus on safety and well-being. And this is at the core of all GC projects before, during, and after the pandemic. So systems and policies and structures were developed and implemented to maintain the contact with girls to monitor their well-being and safety, while strengthening safeguarding messaging and protection. And this involved communities and parents during COVID-19, and many of these groups took up the mantle of child protection and referral and safeguarding and continue to do so independently of any kind of programming. And very quickly, projects saw that the most effective distance learning modalities did not rely on students having access to devices or electricity. The hybrid models of learning opportunities have continued after the pandemic. You know, interventions include the provision of learning packs, printed materials, all the things that we know around learning support from teachers and community volunteers, but those alternative ways of borrowing books or reading clubs being run by local teachers and community volunteers. And projects were able to support via phone and small learning groups. You know, younger community members mentoring girls provided learning support, but this was something that projects did prior to, during, and after COVID-19 because of their focus on the most marginalized girls. Parents were key, and projects supported parents through phone calls and home visits to create safe learning environments. Projects also worked alongside government to create content for the national level programming of TV and radios too, and establish small learning circles. In terms of learning content, the 5th one around learning content was there was a variety of resources across the GEC. Particularly successful were materials that were encompassed barriers to return to school, so children tackled the topic as they learned. So there was sort of an amalgamation of that. It was also key to support teachers to kind of diagnostically assess student levels of learning on their return to education, and then have teaching at the right level or remedial structures, etc., is in place. So there's a more flexible approach to maintaining learning levels and increasing them. And lastly, those projects that started distance learning activities and coordinated with national government pandemic responses, they did this through engaging with officials and aligning activities. They saw the most success. Making returning to school a primary focus was key, but also recognizing the shift that girls had undergone and the need for flexibility on their return. And that might be around timing or access. Projects strengthened and accelerated their relationships with many ministry officials, including in Rwanda, community leaders and stakeholders, by coordinating their activities to reach marginalized girls. And just very lastly, in terms of uptake, you know, projects have fed into national frameworks. They've influenced out-of-school policies, they've co-authored curricula, shared learning resources that have been rolled out nationwide. There are examples in Zimbabwe through the SAGE project, the CAMFED Learner Guide model, where projects can coordinate together across a country. They have set up structures to bring the most marginalized into the system and spaces that exist. Some of these have been embedded into the existing system. For example, the Girls Inclusive Education Network in Nepal. I'll pause there. Thank you, Anna Maria.
Thank you so much, Emma, for flying through all your great evidence and presenting this synthesis. I certainly learned a lot from you just now. So let me turn now to you, Julia. Your focus is, of course, on inclusive education. Could you tell us a bit about how children with disabilities were supported during the pandemic to continue their education, and whether you could highlight any particularly promising practices that you saw over the past 4 years?
Yes, thanks very much, Anna Maria, and it's a pleasure to be here. Yeah, at HI, we were really concerned, obviously, like everyone else, about the school closures, which of course affected all the 26 countries that we were working in at the time, including Uganda and Bangladesh, I think, were closed over a year. So we really wanted to see what we could do to stop children with disabilities falling behind. And as we've mentioned, we saw that the many education response plans that you've heard about did have distance learning options through virtual platforms, radio lessons, TV lessons. And we were indeed concerned that many of those weren't disability inclusive, although, as we know, in Rwanda, that was somewhere we were helping to make sure that was inclusive, and many other countries did the same. But unfortunately, many weren't necessarily thinking with an inclusive lens. So yeah, I think what we'll start by mentioning is similar to Emma, really. We really wanted to look at how could we make use of what we were already doing that could continue. So we started at grassroots, really, on the ground, community organizations that could maybe innovate more inclusive ways of delivering education during this disaster. We obviously, it's not ideal to have schools closed, but because they were closed, what could we do about it and actually innovate new ways of learning? So we also work with grassroots organizations, community mobilizers, from organizations of persons with disabilities and other community groups that could support, that perhaps previously had been working a different way, so maybe more home-based, or maybe they could support with small group lessons, bringing children together in small numbers at community level so that they could have that social cohesion, but in small groups where it was possible. And that was done, for example, when radio lessons were maybe being rolled out. A challenge for some children might be that they couldn't understand the lessons, or they couldn't hear the lessons if they were deaf. So those facilitators could also include sign language interpreters, for example, or also other community workers who could help, encourage children to listen, to make it more fun, make it more interactive. Because obviously working alone at home can be very challenging for many children, and they need that support to actually be able to engage. So we found many of those small scale community initiatives really made the difference. And so some of the structures that we'd previously been working on, for example, mobile teachers moving between schools or classroom assistants, were kind of redeployed to work at home and engage with parents. And that engagement with parents was one of the crucial aspects. But what was important was to make that link between what was going on at community level and having that being part of these education response plans, so lobbying to work at national level, to be able to make sure that was part of it. So that I think in Nepal there was a focus, for example, on the education response plan, ensuring that parents were engaged, and as we heard from Rwanda, there's also that focus on lessons for parents, how to work at home with your children who have disabilities or learning needs. So bringing those two things together was crucial. I'd also like to mention the importance of linking public and private partnerships. We also saw the benefits of supporting that in countries where we've heard, obviously there's an issue with access, and for children with disabilities, access to technology can be a game changer, but obviously it's very challenging in the context of needing internet, needing electricity. But in some countries, there were some private partnerships, for example, with, I think it was Safaricom in Kenya, that allowed free downloads for school lessons using mobile phones. So where there were these kind of connections, it really supported children with disabilities to access some of these materials that were able to be inclusive for them. I want to finish by talking about an issues paper called Pivoting to Inclusion, Leveraging Lessons from COVID-19 for Learners with Disabilities, which was published by the World Bank in, I think, 2021, and a group of us were involved in supporting that. It laid out some key recommendations, which is too many to note here, but I'd just like to finish with a couple of them. One was to rethink education with an inclusive lens for learning. So by, when we were reestablishing how to do education because of this huge shock into the whole world in terms of the education rollout, to really then reestablish how to do that in a more inclusive way using universal design principles. preparing and supporting resilient and inclusive teachers, providing training on psychosocial support, and adequate training on teaching with technology, because a lot of that, teachers were thrown into it without actually knowing how to use the technology that they were being asked to use remotely. So that all needed to come part and parcel. And these are things that have been, we've seen the take up has been good in some places, but the challenge has been to see it scaled up on a national level. So whilst we have seen since the pandemic some of these new hybrid ways of working, maybe including technology within some lessons in some contexts, for example, using apps that might support children with disabilities to learn sign language, or using tablets that might have sign language lessons embedded in them, digital accessible textbooks. These kind of things are happening, but it's on a small scale. So I'd like to finish by saying that that's been the challenge that we've seen, that whilst these initiatives were great at the time, we haven't seen it at the scale we'd like to see it now. Thanks.
Super. Thanks so much, Julia, for highlighting all those points. And again, the importance of parents and communities that we learned during the pandemic. So next I'll turn to Rob. Rob, obviously UNICEF works across the world, from development contexts to conflict settings. And so could you tell us a little bit about what UNICEF learned about supporting education response during the pandemic for the children who were already living in a crisis situation?
Yeah, thanks. And I'm really pleased to join this panel, and thanks for this opportunity. I'm going to try and build on earlier comments because not to repeat what others have said, but I think, one point I'd like to raise is we were obviously globally, and when I say obvious, all of us are in the education sector know we were experiencing a global learning crisis before the pandemic. This webinar and what we're discussing now is what we've learned from responding to the school closures, et cetera. But obviously, if we were starting on a stronger footing, it would have been much easier to address such challenges. But of course, the world was experiencing very significant disparities, underinvestment, and a very challenging, fragile education systems around the world before the pandemic. And then, of course, as has been repeated by other panelists, we have school closures, and that's disproportionately impacting the most marginalized for all the reasons that my fellow panelists have mentioned. So what is interesting, I think globally, the picture was very disturbing overall and continues to be in terms of overall, but we have some amazing examples at country level leadership and country initiatives that are showing the path for others, and one of which is represented here by the Permanent Secretary from Education Rwanda. Some amazing examples as he shared, and others. So in my sort of current function at global level, it's hard to be optimistic when you're looking at global statistics, but countries, and certain countries, are showing some amazing abilities to have been resilient and proactive at the time of school closures and subsequent. So what I'm actually really fascinated by now is why are some countries doing this and others are not? And it would be interesting to hear other panelists and other thoughts on what's the secret sauce that some of those countries have. Is it leadership? Is it something that has generated such wide range in difference in performance, if you'd like, during the time of school closures of COVID and afterwards? Even just the length of school closures is an interesting indicator, but of course there's many others in terms of impact that COVID has had on children if you look across countries. Your question around what we've learned is, many of us, including GP, are part of this foundational learning compact, a coalition of organizations working together on foundational learning. And what I take away from a global perspective is the crisis of school closures around the world did give us a very unique opportunity to come together as partners. I think pre the response and post the response, you see a difference in a commitment of global actors like UNICEF and GP and others to work closely together and support in a more coherent way country level work under the leadership of countries. So that was a lesson that we need to encourage us all at global level not to revert to sort of bad practices pre-COVID and continue the spirit of collaboration globally. under the leadership of government, so that we're all kind of supporting and pulling and encouraging in the same direction. I also think we have seen the level of commitment to addressing disparities has increased. I think it did, the school closures shed to light the disparities that were existing pre-school closures. And I think that sense of awareness and commitment to address those disparities has continued in some countries. And that has been encouraging. It is, I think, also in continue to at global level. There is an interest. And if you just do a literature search of globally, I think you'll see far more pronounced a commitment to addressing gender-related barriers, addressing other barriers that children face, because it was just so obvious and explicit at the time of school closures what a disproportional impact. I think, as other panelists have also mentioned, the really exciting silver lining on a very challenging time was a recognition of the importance of schools that go and the role they play in children's lives and communities' lives beyond education. And my fellow panelists have already discussed in a sense, I think, sadly, that was due to a negative, meaning a recognition of the impact on psychosocial well-being, on, as was mentioned, HIV, on now the lack of access to midday meals, the lack of access. It was due to now the lack of or discontinuing access to services of schools that I think people were like, oh my goodness, schools are far more than just enabling my child to learn. It's a little like when you're healthy, you never appreciate being healthy. When you start to be sick, you're like, oh wow, the days when I was healthy, when you have a headache or something. So I think we have to encourage ourselves not to forget that lesson as we revert back to, as we're all reverting back to business as usual. I'm going to come in a bit later on some of the nuts and bolts on some more programmatic, but I think I'm going to just leave it at that point. And again, just thanks again, and really appreciate all the comments my fellow panelists have also offered.
Thank you so much, Rob. And actually, that was the perfect segue to our next speaker, Don, who is working actually at the intersection of education and health. And of course, thinks a lot about how schools play a role in lives of children beyond just the education outcomes. So, Don, if you could outline a little bit about what is known about the impacts of school closures on the most marginalized children, and would love to hear your thoughts on whether we should do anything differently as a sector going forward, knowing what we know now.
Great, thank you, Anna Maria, for this this opportunity. And I particularly want to thank Permanent Secretary Kareki from Rwanda for setting the scene at the beginning and reminding us of how chaotic it all was and how none of us knew what was coming next. This was something we'd never experienced, and we all had to find a way forward. And permanent secretaries, of course, actually had to make decisions on the basis of the information that was available. And I want to remind us how fast that all was. It was January 2020 when we were starting to hear about COVID, and it was March and April 2020 when 1.5 billion children suddenly found themselves out of school. It was a really dramatically fast-moving game. And in those very early days, there was a lot of discussion about what should be done. This is when we started talking about lockdowns and all of those sorts of events. And one of the things that the health world, and I'm speaking on behalf, I hope, of both education and health in thinking about this, in the health world, there's a lot of experience about seasonal and epidemic influenza in schools, and the way that shutting schools was a good way of preventing that influenza from really driving out into the community in general. And that's a trick that's used quite often by public health folks, shutting a school for a week or schools for a week in certain countries. And all the experience around that was based on those kinds of diseases where the transmission is all about young people, and young people are an important vector of transmission to the general community and so forth. And so the assumption was, the beginning assumption was, that this was going to be true for coronavirus. Although actually the early evidence didn't suggest that. They suggested that kids actually weren't the drivers of the epidemic. Nevertheless, there was huge pressure. I mean, there was pressure from teachers. Teachers were saying, how risky is it for us to go to school? That was a good question that they were asking. There were the parents were saying, I don't know, what should I be sending my children to school? This sounds all very risky and scary. So there was big social pressure. There was pressure from the epidemiologists, and all of this. We decided to close schools. I was listening to the discussion up till now, and we've behaved as though that was just something you would expect to happen, right? But actually, we've never done that before. The world has never closed all its schools. This was a unique event, and it had dreadful consequences, as my fellow panelists have outlined so clearly and so well. It, of course, had dreadful consequences for education, and we've talked about that, and all the wonderful efforts to try and mitigate that, which of course couldn't replace schools. That's one of the things we discovered. But also there were far-reaching implications beyond that about how education systems were used to support young people, school-age children and adolescents, and all of those support systems were taken away as soon as you removed the school system. This is the idea of the school system as a safety net, protecting children. It's something we've all discussed many times prior to the pandemic, but we closed down that safety net as part of our reaction. Now, when we start to look back dispassionately at the evidence, there's really the evidence from the health side of the value of closing schools in terms of transmission to the general community or transmission amongst children. That's really very mixed evidence, very conflicting, contrasting evidence of any real benefit from that. It's pretty clear now that coronavirus is not like influenza, and that wasn't a major driver of the epidemic. But we also saw that by closing the schools, we generated a major response from parents. So the parents initially encouraging the closure of school and then pushing back very strongly against it. Parents discovering that they were going to have to look after children all day. They were going to have to teach them themselves. There was a very strong social change in the way in which people reacted to that. And as I said earlier, and as Emma and Julia, you've both been commenting, this is the worst education crisis the world has ever faced. The world has never shut down the opportunity for 1.5 billion children at one time. It was therefore what economists call a counterfactual experiment. If you want to find out whether you really need something, well, stop doing it and see what happens. And we stopped doing schools. And what happened was we discovered that schools were really important in all kinds of ways. They're really important for education, but they were also really important in terms of access and equity and inclusion. I mean, Rob Jenkins gave a great emotional statement around that. We really discovered how important schools were by closing them all down. And governments very rapidly moved towards reopening schools, so finding ways to reopen schools, not only to replace the education, although of course that's the vital part of it all, but also because they realized by then that these were the important school structures. And I'm going to refer to the fact that the governments got together and created the School Meals Coalition in October 2021. It was called the School Meals Coalition because I think for politicians, the idea of school meals is a politically attractive concept, and also, of course, a big budget concept. But really what the School Meals Coalition was about was putting systems back in place that really mattered. If I refer to Rwanda again, very modest of you not to mention it, Permanent Secretary, but Rwanda fed 600,000 children every day before COVID. Today, it's feeding 3.8 million children every day. It's remarkable. And this is an exceptionally good example, but it's not a unique example. In fact, when the world, I'm just using school meals as a sort of indicator, before COVID, 388 million children being fed every day. After COVID, 420 million, 30 million more children, and that's still going on. So the picture is that we've changed the way we think about schools. I think we've really moved to a different place. And one of the questions we might want to, or a couple of questions we might want to ponder about is how would we react? How would the world react a second time? How would the world react if we were all asked again to close schools? What would countries think about that? I think that's something we could ponder upon. Would the governments even consider closing schools? Would that be the first go-to that they would accept? I think we've changed. Things have changed, and I'd be interested to hear from the other panelists how they see that. Thank you.
Thank you so much, Don, for such thoughtful reflections. So actually, let me turn back to the Permanent Secretary and exactly ask you a little bit about your future look. So we'd be curious to know about kind of, now that we've gone through this experience, how Rwanda is building resilience in its education system so that you are better able to ensure continued learning and well-being for all children during any future disruption.
Thank you so much again, Anna, and it is really interesting to listen to the other panelists, how this topic is in terms of the impact of COVID. For Rwanda, I think what we are trying to do today is both to build the resilience, but also to deal with the impacts and some of the challenges that came out because of the COVID-19. And to deal with these challenges, we are currently implementing a remedial learning program. And this program is meant to support students who are falling behind academically and reducing the repetition rates that we've seen after COVID increasing. We are also implementing the school feeding program, as just highlighted by Donat, ensuring that all the students receive meals from the schools. And this initiative has significantly contributed to reducing the dropout also that was on high. The other activity that we are trying to implement, we are providing ICT infrastructure to schools and leveraging technology to offer the alternative learning outcomes to students. By the way of examples, we have now a Rwanda Education Board audiovisual studio, and we currently produce around 135 entertainment episodes that are broadcasted through radios and televisions. I also want to add that all the textbooks, curriculum, teacher guides, and other educational materials are now available on e-learning platform. Another activity is now about teacher recruitment and the capacity building, investing heavily in the recruitment of the teachers and their professional development to ensure that they are well equipped to teach in a diverse classroom effectively. We are also providing accessible digital textbooks, ensuring that all textbooks are accessible for children with disabilities, and thereby trying to promote inclusivity and equal access to education resources for all the students. Because of the impacts of COVID, which actually resulted into a high level of enrollments, especially in the primary section, where we saw, because of the double cohorts, of course, as earlier mentioned, all the students spent almost a year at home. So we expected the double cohorts in primary one. And because of that, there was a lot of pressure on the need for the infrastructure development And the government now is trying to which would definitely impact the learning environment. So briefly, the marginalized children, including those with disabilities and refugee children and those from poor family backgrounds, were really they were affected by the COVID pandemic and were more vulnerable to the effects of school closures. However, through collaborative efforts with other ministries and other partners like GPE, like UNICEF, the education sector response plan was implemented and reaching vulnerable children and addressing the educational needs. So the challenges persist, but the Ministry of Education remains committed to ensuring that every child is reached and is given the opportunity to fulfill their potential. I pause from here. Thank you so much.
Thank you so much, Permanent Secretary. We're so delighted to hear about all these initiatives and the thoughtful way that you are still addressing the lingering impacts from COVID on the most marginalized children. So we are definitely running out of time, which I think is a good thing because we heard so many wonderful reflections here. So if I can just turn to Emma, Julia, and Rob, if I can have a very quick one-sentence response from you about what is to you the most important takeaway from the pandemic in terms of reaching the most marginalized children? Starting with Emma.
Okay, I'll be really quick, but slow. I really think if one thing the pandemic taught us is we don't always know who the most marginalized are. We think we do. And I think because of the intersectionality, I think things shifted a wee bit. And if we are really serious about reaching the most marginalized, then we have to have an in-depth understanding of marginalization with a detailed and careful approach to identifying and actually reaching those marginalized girls and boys, and then understanding there's an intersectional approach that actually is really important for all facets of implementation in our work, because we know that changes from time to time. So that's my one sentence.
Thank you so much. Julia?
Thanks. I'll be super quick. I think we've seen from Rwanda, what works is collaboration across all levels, including UN, governments, CSOs, everybody coming together and coordinating, and multi-sectoral support outside of education, including health and other sectors. But if we don't have the finances, we're not going to be able to implement all the recommendations we saw and the lessons learned. So we need sufficient financing. And where it's there, then it works. And where it isn't there, that's when we have the challenges.
All right. And Rob, to you, the last word, please.
Well, maybe to build on those three earlier comments, I think one, it's commitment. What we see between countries is one of the indicators of those who are addressing are those who are committed to address marginalization, sort of reduce disparities, if you like. Two, it's focus, and the entire system, enabling that. And third, we need to recognize we need to do things differently. We need disruption in order to make this to happen.
All right. Thank you so much to this superb panel. Can't say enough how much we appreciate you being here. So I won't actually close with any further words because we're at time. So, but you all wrapped it up so well. So now actually we are going to be moving on to the next thematic session, which is on adaptive implementation. Thank you so much, panelists. Please feel free to stay. Okay, so we will just put up the slide here with our next session. All right, and I'm handing over to Margarita.
Thank you, Anna. Thank you, Anna. So yes, we are going to move on to another related subject. And this is the last thematic session of our COVID-19 virtual learning event. So to start, I'm Margareta Focus-Licht, and I'm the manager in charge of partnership effectiveness of the Global Partnership for Education. And this session will focus on how education ministries and their partners have adapted implementation over the past 4 years in response to evolving situations, and what more we need to do as a sector to be more agile and better able to support preparedness and response to future disruptions. So let me just start with a few thoughts to set the stage for this discussion. The COVID-19 pandemic was a time of continuous uncertainty, and I'm sure all of us felt that in our own lives as well as in the work that we did. So education actors and decision makers across the world needed to navigate the continually evolving pandemic alongside policy decisions and evidence about effective approaches to continued learning and well-being. And from school closures, masking, and social distancing to the return to in-person schooling, education delivery needed to be agile and adaptive to be effective. So we're here now to look at how education actors navigated the constantly changing landscape during the pandemic, so that we can consider not just what the lessons are, but as the Executive Secretary of ADEA reminded us yesterday, how we might translate evidence from these experiences into action with the aim of improving learning outcomes. To build more resilient education systems for the future, we have a lot of work to do to ensure better outcomes from children. So I'm pleased to introduce our distinguished panel, starting with Dr. Martin Benavides, Director of the UNESCO International Institute for Educational Planning, as we all know as IIEP. Dr. Benavides served as the Minister of Education of Peru from the onset of the COVID-19 pandemic in 2020, and he oversaw the country's pre-primary, primary, secondary, and higher education systems and designed the national strategy for distance education in response to the pandemic. So he is here not just as the director of IIP, but also to share his experience as a minister. Welcome. Thank you, Martin, for joining us today. We're also joined by Mr. Mohammed Chehem, who is the Dean Inspector Coordinator of the School of Excellence of the Ministry of National Education and Vocational Training of Djibouti, where the ministry began implementing a COVID-19 response project in April 2020 with the support of GPE and the World Bank. And Mr. Chehem coordinated this response project. Aside from his work on the pandemic response, he has contributed to multiple education reform processes in his country. Welcome, Mr. Chehem. And I hope I am pronouncing your name correctly. We are also welcoming back Robert Jenkins, who's not off the hook quite yet. He was on the last panel, and we are happy to have him join this panel as well. Hopefully you stayed, Rob. Yes, great. As Anna introduced him, he's the Director of Education and Adolescent Development at UNICEF headquarters. He joined UNICEF in 1995 and brings over 20 years of experience in international development and humanitarian programming in Africa, Asia, and the Middle East. And we heard some of his experiences already in the last panel. Welcome, Rob. We are also joined by Alison Grimslund, who is a senior education specialist and literacy specialist at the World Bank. Alison has more than 15 years of experience in the sector and currently works in the West and Central Africa region, where she focuses on developing and implementing large-scale lending projects in basic education, education sector support, and youth employment. Welcome, Alison. And finally, we have Dr. Faiza Hassan, who is the Chief of Party for GPE programs with Save the Children in Somalia. And Dr. Faiza has more than 15 years of experience in designing, managing, and implementing large-scale complex programs. Welcome, Faiza. Thank you for joining us. So once again, we have a wonderful panel, but we'll start with Lorenzo, who will share some insights from the evaluation related to adaptive implementation and resilience in GPE COVID-19 grants. So over to you, Lorenzo.
Thanks again, Margarita. We're going to start by looking at the granting mechanisms with the AF grant. And what we saw as being quite successful here was adaptability. The COVID-19 pandemic was fast evolving. There was a lot of uncertainty. Folks didn't know what was needed and how long it would last. But the grant design allowed for this. Time extensions were the most frequent type of major revision requested, with over 48 extensions requested across 30 of the grants. Other types were less frequent, but grantees requested budget changes and timeline changes as well. The reasons for these requests, though, were not so much to do with the pandemic itself, but rather political context, security concerns, other emergencies going on around the same time, capacity issues, and changing priorities at the ministerial level. And I think what's key to note is that though there were many requests around budgets and timelines, etc., there were only 6 requests to change scope. And some of these were clearly a reaction to the pandemic. So in Ethiopia, 2 scope changes and 1 deadline change were due to the reopening of schools in October 2020, later than planned. This meant that implementation was delayed. And though the planned distribution of offline learning materials for home to students had not been completed as planned, a further 4.9 million were reallocated. At the same time, though, we have countries where changes in scope were not due to the pandemic itself. So really, the question we need to ask ourselves is, where countries using the adaptability afforded by the AF grant? Another reason for some of the cases of adaptation were the mismatch between the level of tech required and technical constraints faced by users. So for instance, in Cote d'Ivoire, radio-based learning was found to be far less popular than television. And anyway, both of them had low uptake in rural areas. So the government was responsive and canceled a plan to provide radios in rural areas, focusing instead on exercise booklets. So once more, we do have virtuous cases of countries that were able to readjust. This just wasn't occurring necessarily through the granting facility. Another key point we'd like to drive home is that we saw yesterday how there were some technological and implementation challenges, but many of the grants, including those around remote learning, have the potential to support system resilience through capacity building over the long run. We need to think of many of these grant proposals as experimental. Remote learning solutions supported by GP could have a positive legacy impact. A good example of this is the DRC, where the AF grant made it possible to formalize and implement a priority intervention for the education sector strategy and a new distance education program for students. Capacity here was developed by training over 500 provincial executives. So again, we see this trickling down from the implementation level, trickling up from the implementation level to the policy level. Another way to think about this is COVID-19 is not the only emergency that many of these countries face, and they're likely to face others in future, which may impact continuity of learning. Look at Tonga, a country that's vulnerable to climate disasters. Tonga was able to use the COVID-19 grant to support a new multimodal distant learning resource. This was developed to be reusable alongside teacher training. The upfront cost and investment used to develop this material may yield returns in future emergencies. In fact, we've already seen this. The eruption of the Hunga Tonga Hunga Ha'apai volcano and subsequent tsunamis in January 2022 So roughly 2 years later at the start of the pandemic, were an occasion in which these learning resources were used once more. Overall, I think this begs the question, how many of the solutions we saw implemented over the past few years were unique to COVID-19, and how many might be used in future? The point here is that COVID-19 for some of these countries was an opportunity to test new solutions. I want to re-emphasize this. We need to think of a lot of what happened as experimental. We're seeing this at the policy level. Education plans in Côte d'Ivoire are including digital strategies that were developed during COVID. Ghana is reviewing its ICT and education policy, leveraging the lessons learned during COVID. And a lot of this is also due to some of the lessons sharing that occurred as a result of the global grant. Côte d'Ivoire as well, taking lessons from remote learning to develop a national distance learning strategy. So I think the high level here is making sure that the lessons learned on the ground are being communicated to the policy level and ensuring growing systems resilience over time. Marguerite, I'll hand it back to you.
Thank you so much, Lorenzo. That was a helpful overview. If you could just take down the slide, thank you. We're going to now move from the sort of the general summary of what we've seen to some of the specifics. Unfortunately, I think Mr. Chehem lost his connection, so we'll hope that he is able to rejoin. We are first going to ask for some government perspectives on responding to COVID-19. So, Martin, we're really happy that you're here also as a former minister to be able to tell us a little bit about some of the implementation challenges from your time as Minister of Education in Peru during COVID. Perhaps share a little bit what new ideas came up during the education response and how you adapted the education system. Over to you, Martin.
Thank you very much, Margarita. I think emergencies are very complex periods, especially because different rights intersect: education, health, work. It is very difficult to choose one over the other. And some of those other rights, different from education, has more stakeholders to defend them on the decision-making processes. So from my experience, I think the best way to be prepared and to defend the right to education in this very complicated context is to use evidence. And COVID was unfortunately a period where at the beginning we didn't have evidence for making decisions, no? And then it was late when we tried to come back to the way schools were working before the pandemic. So I will always emphasize that in this context where, I mean, everything is complicated, the support to the right to education will come especially important with the use of evidence. And the other thing that was very important from my experience, and also I think it's a lesson learned for the ministry, is the need for negotiation capacity to defend the right to education, for example, for accessing funding from ministries of finance. At the time of the emergencies, ministries of finance have a lot of demands. So the ministries of education they need to have a group of persons with all the competencies necessarily for convincing Ministry of Finance of the importance of giving money and resources to the education sector in these complicated periods. And then also from our experience, and that helped a lot on the response that we gave, is the support we had from a multilateral organization. Peru was the first local chapter of the Global Coalition, and we were able to have support from UNICEF, from UNESCO, in order to combine ministries of finance, to combine ministries of health about the importance of reopening schools. And that was a very complicated, I would say, debate that we had in Peru. And in order to gain support for the idea of reopening the schools, to have the support from multilateral organization was very important. Also, I will suggest that we don't need to, it's important not to underestimate any crisis. In Peru, fortunately, we didn't underestimate the pandemic from the beginning. And that's why we were able to launch, after 3 weeks of the beginning of the pandemic, our emergency program, combining television, internet, and also radio. And finally, Ministry of Education has a lot of bottlenecks related to the way they are organized internally. From my experience, I would suggest to have always an innovation transversal team, really ready for whatever needs to be adapted, because flexibility is very, very important in periods of emergency. Flexibility for overcoming bureaucratic bottlenecks that always are present. And finally, public and private collaboration raised as never in the past history in Peru. That was a period where organizations with different perspectives get together, and we were able to get the support from, for example, the private television channels, and they give free time for releasing education program. That was something that then they continue supporting this public-private collaboration that were critical for the response that we had in Peru.
Thank you so much, Martin. I think there were several really interesting points there. Just to say, to recap a few of them, you said that when you started out, you really didn't have the evidence to address that crisis. Well, now we do. How do we? And I think that's what we're seeking to look at here. How can we now build on the evidence that was gained during that period? And among other things, not just to prepare programs, but also to be prepared to defend education with ministries of finance and others to ensure that education is financed, that evidence that shows how important, how critical education is and continuity of education in times of crisis. You also emphasized the importance of multilateral support, as well as not underestimating the impact of a crisis, really preparedness. And so actually you've highlighted also the importance of looking now at preparedness for the next crises that will come, and to continue to innovate and to mobilize partnerships across public and private sector. So I think all of those are areas that are really helpful and for us to take forward in this conversation. So we'll get back to you, Martin, but this was a great start. My news on Mr. Tehem is that they have a power cut. So we will just hope that he's able to rejoin the panel later, that the power will be turned back on. But in the meantime, let me now turn to Alison. And Alison, you supported the Gambia during the pandemic, and also I'm going to at the same time turn to Faiza, who supported education programs in Somalia. So do the evaluation, do the findings and experiences that you've just heard from Martin resonate with your experiences of supporting education programs during the pandemic? Perhaps you could tell us a little bit about how you were able to put into practice evolving evidence and work through unforeseen challenges along the way. We know that plans that we make rarely pan out to be implemented exactly how we think. And so I think part of the lessons during the pandemic is also about being adaptive, adapting to circumstances, which isn't just important during crisis, but I would say in general, in all the work that we do. So let's start with you, Alison, if you could share a little bit from your experience.
Sure. Thanks so much. Yeah, so as you said, I was supporting the Gambia and also Senegal at the time. But the Gambia, we had a GPE and World Bank project, and then we're able to get one of the GPE grants that you were talking about before. This was a small amount of funding, but it had an impact. The Gambia is small; it's not as small as this amount that we got, which was 3.5 million. But it let us focus efforts just on responding to the pandemic with that amount of funding, whereas the other project, which was supporting more sustainable elements of the education system, we could do that. There were a complex set of challenges for a place like the Gambia when we think about the pandemic, because it's a small country that has limited capacity. There's not a network of universities and things like that, right? So there's basically more or less one university. And so that creates huge issues because they're heavily reliant on international technical assistance. And at the time, we could not get any international TA in or out of the country. So we had to be really creative in terms of how could we have partnerships with local, there's not a ton of local organizations on the ground, but which ones were on the ground? Could they have international TA that could then link with them, work with them, to be quite creative in that regard. Now, the technology issues were also extremely challenging because the kind of minimum of infrastructure didn't necessarily exist. So we talk a lot about connectivity in schools, but we maybe don't talk as much about connectivity even of ministries, right? So counterparts in the Gambia could not join conferences or even discussions from their own homes, right? They don't necessarily all have connectivity even in their own homes. So that kind of need to bring everybody up to that same minimum level, even to have relationships between ministry staff, is something that we just don't talk about very much, right? We're focused on, we need to get schools, we need to get universities, but even the minimum of having, we have a colleague who's just been pushed off because there was a power cut, right? The representative who's going to speak. And that really, really creates an issue in terms of being able to do business. So that allowed for more investments in those kinds of infrastructure that we need, that we sometimes shy away from in the education sector, but that honestly, we can't really do business without. So that kind of pivot. And then I have to say the evidence was really helpful. As it was coming, like the colleague from Peru said earlier, it was at the beginning, we just didn't really know much. So with some of the GPE financing, we were able to do high frequency surveys. That means once a month, there were phone surveys that went out and they were nationally representative in the Gambia. They crossed many sectors actually, but we had an education module that allowed us to get real-time information. Were parents able to access television programming? Did they find it useful? What were perceptions of the ministry? What areas did they need more support? The GEP project also provided things like school feeding, where the school feeding basically had stopped at that time because we had a lot of food insecure children. So getting this kind of rapid feedback was really helpful. And quite frankly, it forced us to innovate, right? Because we do a lot of surveys, but we don't do them super quickly and are able to digest the information super quickly, but it forced us to be able to do that. So I think that was a hugely important innovation where we were trying to think about the evidence, but also in real time, right? How can we use that to pivot some of our support more effectively to actually reach children in the ways that they needed to be reached for schooling? I will stop there. Thanks so much.
Thank you, Alison. That's really, actually, that was really fascinating. Just to get that insight into on the ground, especially the survey and real-time evidence and how that helped you to adapt. I think that's a really interesting lesson. Also, when you talked about the lack of ability to bring in technical assistance, what really comes to mind for me there is, are we good enough in our ongoing work at actually supporting strengthened capacity so we don't rely less on international technical expertise? I think that's another key takeaway from what you just said, among other things. Thank you for that. Faiza, from your side, please.
Thank you. I hope my internet and electricity holds. I'm calling in from Somalia. And so our experience of implementing during COVID in Somalia is probably very similar to other fragile contexts where you have existing emergencies. And so we deal with conflict, instability, recurrent climate shocks. And so our situation was really complicated before COVID came along. And COVID just made things much worse. Schools closed suddenly in March 2020. And almost overnight, we had to consider this massive shift to digital options and distance learning solutions. And like other colleagues have said, at the time, there was a lot of uncertainty. We didn't know how long things would take or how things would evolve. And so in terms of implementation, we really drew on our prior experience with adaptive programming in response to uncertain situations like a conflict or instability. We worked with the government to set up a COVID response task force, develop a response plan, and applying to the GPE COVID response grant was really quick and flexible. And in addition to that, actually, we could restructure our other GPE funded program, like the implementation grant to include COVID response components. And I think our experience in Somalia really aligns with some of the main findings of the evaluation, in that one of the biggest lessons learned from operating in an unpredictable context is that you program really simply. The simpler your interventions are, the more likely you are to succeed. So keep it really simple. Another big lesson from our side, being really in a very unpredictable environment, was that you plan to make a lot of small changes along the way on a continuous basis, rather than waiting for one or two large reprogramming opportunities. And so that's how we approached our implementation during COVID response. We kept our program simple, focusing on very few interventions, and we made a lot of small changes along the way. And at the time, of course, the most obvious challenge for us was the lack of infrastructure and connectivity. I hope my internet lasts right now. And so, when it came to teachers and parents and students, it was really a challenge. And like other colleagues have said, a country was more likely to succeed in its response if some of the basics were already in place, which wasn't the case for us in Somalia. And so, yes, we developed an online distance learning platform and the TV lessons and radio lessons. But more important for us was the printed materials distribution to students. Much more important was also pre-recorded radio lessons distributed to students, and also trying to push some content through mobile phones, because a lot of people have access to mobile phones and it's easy and simple. And so I think I will end by saying that the shift was really one that we didn't expect at that scale and with such speed, but it did give us an opportunity to experiment with different things, different models, and it gave us really some valuable lessons that we hope to continue here in Somalia, because we deal with crises as a norm here. And a lot of the things we learned through the COVID response are really becoming more embedded in our education system. Back to you.
Thank you, Faiza. That is also really fascinating. You're taking us into sort of the challenges that you dealt with. And I took away some keywords: flexibility, simplicity, absolutely. And also this small changes on a continuous basis, rather than sort of trying to look at the big adaptations. I do see that we have Mr. Chehan back with us. So maybe I can take a step back to get another government perspective at this time. I was joking with my colleagues that I'm doing adaptive implementation right here. We're just figuring out how to order things as we have to deal with the connection issues. But Mr. Chehan, maybe you can tell us very briefly about during the implementation of the COVID response.
Oui, absolument, absolument. Je vais parler.
Oui.
Je m'excuse parce qu'on a eu une coupure d'électricité.
C'est ce que nous avons bien. Oui, c'est ce que nous avons bien compris. Nous sommes très contents que vous avez pu nous rejoindre. Merci d'être là.
Par téléphone maintenant. Par téléphone, parce que Il n'y a pas encore d'électricité.
OK.
Donc, d'abord, je vous remercie de m'avoir associé à ce webinaire qui est très intéressant. J'ai pu suivre le sujet sur l'inclusion.
OK. Je vais vous poser peut-être une petite question pour que vous pourriez un peu brièvement nous dire comment le ministère de l'Éducation à Djibouti a été capable d'utiliser des connaissances. I'm going to say the question in English so I get it clear. How was the Ministry of Education in Djibouti able to make use of the knowledge, evidence that surfaced about what interventions were relevant as you were implementing the response? And how did you use knowledge to improve the education response? And what were some of the implementation challenges that you had not anticipated during the pandemic? I will hand over now to you, Mr. Cham.
Le ministère de l'Éducation, vous savez, à Djibouti, la pandémie a éclaté en mars, comme partout dans le monde. Le 23 mars, il y a eu le confinement général de la population, ce qui a été obligé, le ministère a été obligé de fermer les écoles. À la suite de ça, nous avons mis en place une riposte au niveau de l'éducation nationale pour sauver l'année scolaire qui était presque achevée. Et là, nous avons essayé de mettre en place la continuité des apprentissages en utilisant bien sûr tous les canaux comme la télévision, la radio, les plateformes. Donc vraiment, on s'est beaucoup mobilisé, le ministère de l'Éducation nationale, avec l'appui bien sûr. Le GPE a mobilisé pour nous un fonds d'urgence et ce fonds d'urgence, dans le cadre de ce projet de riposte, nous a beaucoup aidé et nous avons mis en place beaucoup de choses. Pas mal vraiment, on a eu des données très probantes. On a eu le téléenseignement, les émissions à la radio. On a utilisé aussi les classes virtuelles, les plateformes. On a même fait évaluer les élèves professeurs en ligne. Nous avons fait beaucoup de choses. Et vraiment, grâce à ce projet de riposte contre le COVID-19, le ministère a mis en place aussi l'enseignement à distance. Nous avons formé les professeurs, plus de 1500 professeurs. Nous avons formé les inspecteurs, les conseillers pédagogiques, les professeurs à l'enseignement à distance. Et ça a été très utile pour nous pour faire progresser. Il y a aussi, après la pandémie, le retour à l'école. Pour cela, nous avons utilisé la plateforme Kobo avec l'appui de la Banque mondiale et nos partenaires. Et c'était vraiment des données très probantes qui nous a permis de ramener les élèves qui avaient quitté l'école. Et le retour à l'école était vraiment très intéressant. La scolarisation, aujourd'hui, Djibouti fait partie des pays vraiment qui vont, Inch'Allah, nous allons déclarer la scolarisation universelle d'ici 2025. Donc, la période Covid nous a permis vraiment de voir, surtout dans le domaine du numérique, de faire des progrès très intéressants. Voilà, maintenant les défis, bien sûr qu'il y a eu beaucoup de défis. Le premier défi, c'était bien sûr les risques de contamination des cadres. Donc, la pandémie, la peur de Covid était omniprésente dans les esprits. Bien sûr, certains de nos collègues ont été affectés, certains sont morts. Nous avons perdu beaucoup de collègues, même un inspecteur est mort à cause du Covid. Ça, c'est des défis énormes. Deuxième grand défi, c'était comment assurer la continuité d'apprentissage dans les endroits où il n'y avait pas d'électricité. Donc, pour cela, nous avons mis en place des fascules. Nous avons recruté des moniteurs sur place dans les villages et qui assuraient, qui expliquaient, qui faisaient aller des maisons en maison. Et nous avons également aussi laissé les cantines scolaires ouvertes. Ça a été vraiment une très bonne expérience parce que pendant le Covid, nous avons maintenu dans les zones rurales les cantines ouvertes parce que, bon, il y avait aussi des problèmes d'alimentation chez les enfants. Donc, autour de ce projet-là, c'était un grand défi pour nous, mais quand même, on a essayé de résoudre. Les zones aussi où il y avait les réfugiés, dans les villages des réfugiés, dans certains villages, il n'y avait pas d'électricité. Nous avons distribué des fascules pour assurer la continuité des apprentissages. Le troisième grand défi, c'était la digitalisation de l'enseignement. Avant le Covid, nous n'avions pas des studios. Donc, avec le projet, nous avons acquis 4 studios CRIPEN. Le CRIPEN, c'est le Centre de recherche d'éducation et d'information du ministère. Et avec le projet, nous avons acquis 4 studios qui sont équipés avec des moyens matériels les plus sophistiqués. Voilà les grands défis que nous avons pu vraiment relever avec l'appui de nos partenaires, bien sûr, avec le GPE, que je remercie vraiment, Adrien, et j'espère qu'il est là. Donc, c'est vraiment quelque chose de formidable. Voilà comment nous avons...
Thank you so much, Mr. Teham. That it's really interesting to hear about the very comprehensive approach you had. And one thing that really struck me is that you also mentioned the fear that people were living in, and of course the pain of seeing colleagues lost. And someone yesterday also mentioned about the loss of so many teachers during the COVID pandemic. It's really important to keep these human this very human and vulnerable side in perspective as we're discussing this. Rob, I will now turn to you. Knowing that UNICEF played a key role in supporting countries to quickly plan and respond early on in the pandemic, could you share a bit what your experiences were, especially with multi-sectoral coordination during the education response, including the role of health in the development and adaptation of education response plans? Well, can you tell us a little bit about what you thought worked and what didn't work so well?
Well, thanks, Margarita, and it's so exciting and really informative to listen to my other panelists. So, and in the previous discussion, I think it's been repeated over and over and over in multiple forums and multiple documents, the importance of multi-sectoral approach. So I'm just going to take that as given. We all know how important it is. And so I'm going to zero in on my own 2 cents on what seems to be our lessons on how to make it possible, what's worked and what are the challenges. So multi-sectoral meaning health, education. Within schools, we provide other services, health and nutrition and water and sanitation and sense of protection. So recognizing how important that is, recognizing the impact COVID and school closures had on that, and now a recognition as we're now rebuilding systems. One of the lessons is the importance of us, and it's going to sound kind of basic, but working in partnership. And that really means across both all the global actors, the UN, GB, and others, the World Bank and others, but also different ministries needing to work in partnership together. And as I think everyone will recognize, that's a challenge all over the world, because obviously accountability systems tend to be more sectoral. Ministries of education, ministries of health, ministries of often construction or water and sanitation, and so how to encourage a partnership or encourage collaboration that breaks through those sectors and recognize that we have shared accountability for the whole child, if you'd like, and therefore provide services and leverage schools to provide services across the more diverse needs of children. So I think it's recognizing that we do have these sectors, and the accountability primarily rests in sectors within governments, but also in many agencies. And to acknowledge that by working more collaboratively, we can meet our accountabilities and obligations more effectively. Meaning, if I'm in the Ministry of Health or the health partner, by working closely with schools and closely with the ministries of education, I can improve the health outcomes of children, which is my accountability. Now, UNICEF, because we are multi-sectoral, I mean, I work in education, but I have colleagues down the hall that are working in health and colleagues downstairs that are working in water and sanitation, et cetera. We tend to work in that way. However, we also find it challenging because, again, I'm more interested in education. So I do think it's important for us to recognize the importance of partnerships, the importance of, by working more effectively together, it can meet our own respective accountabilities. But it is indeed challenging. We have seen in some countries, they have broken that through, often because of a higher level leadership, a prime minister or a head of state, president who has pushed it forward. And if you'd like, everyone, all different parts of government, all different parts of all different agencies have worked together around that leadership, and or one part of government, Minister of Education, or has been delegated to crowd in all others. So I do think we need to kind of look under the hood, look at accountabilities of senior decision makers, and see how we can encourage them to work together. And those that have leapfrog services at school level, so critically important, as we've all recognized. I also, maybe the last thing I'll say is on this is, I think, and colleagues have already mentioned it, with that inspiration of collaboration and partnerships at national level and us globally falling in behind that, then it requires breaking that down in that ends up into more sort of bite-sizable chunks that enable monitoring of those accountabilities. So we agree schools will provide multi-sectoral services. There's senior leadership behind that, both globally and at country level, and we're all lined up. Then it needs to break down into targeted indicators that will enable us to, in a sense, enable us, meaning all of us working for that child at that school, to hold each other accountable and know where, when, and how corrective action needs to be taken. So translating that global leadership and vision, the national leadership and vision on multi-sectoral into kind of measurable monitoring systems that enable effective implementation. We've also seen where that has fallen short. We've seen amazing examples of where that's taken forward and made a real difference. Hope that's helpful, Margaret.
Thank you, Rob. Really helpful, and a lot for all of us to think about there, I think, because how we act as partners actually influences how ministries at country level are able to also work together. So we have some responsibility in exactly following through on some of the things that you said. Now we're a little short of time, but I want to give everyone at least 90 seconds for one last question. And I'm going to start with Mr. Cheham this time. Perhaps you could just share very briefly how Djibouti is using the experiences that you've had so far in preparing the education system for future crises.
Merci beaucoup de m'avoir donné la parole. Pour mieux préparer le système au choc extérieur, le ministère de l'Éducation nationale a mis en place de nombreuses initiatives. Je peux parler de quelques-unes, on n'a pas beaucoup de temps. Je peux parler de ce qu'on appelle la stratégie de la réatique. Réatique, c'est rénovation des enseignements-apprentissages par les technologies d'information et des communications. Donc, c'est une stratégie qui nous a permis de rénover l'ensemble des curricula de l'enseignement fondamental, c'est-à-dire primaire et collège. Nous avons également renforcé l'enseignement à distance. Donc, comme j'ai expliqué tout à l'heure, nous avons formé des professeurs avec l'appui de l'expertise internationale. Les professeurs sont formés à l'enseignement à distance. Nous avons également encouragé la solidarité et l'esprit d'équipe au sein de l'école. Ça, c'est vraiment, ça nous a servi aussi une leçon pour les Covid. Donc, aujourd'hui, il y a beaucoup plus de travail d'équipe au sein de nos établissements qu'il n'y en avait pas avant le Covid. parce que les professeurs, comme vous connaissez, sont déjà individualistes, hein, préfèrent travailler seuls. Maintenant, avec l'expérience de Covid, donc on a vu la vulnérabilité des systèmes. Donc, nous avons renforcé la solidarité et l'esprit d'équipe et surtout l'ouverture de l'école à la communauté. C'est-à-dire il y a une meilleure implication de comités de gestion des écoles et des associations des parents d'élèves. Donc, aujourd'hui, si un élève n'est pas venu à l'école, les parents se mobilisent. Pourquoi? Il y a aussi, tout à l'heure, on a vu le séminaire sur l'inclusivité, on a davantage mis en place une stratégie pour l'inclusion des élèves à besoins spéciaux qui souffrent des handicaps. Donc aujourd'hui, Djibouti s'est doté d'un grand centre pour accueillir ces enfants. On les a déjà mis dans les écoles. Ceux qui ont des forts handicaps sont dans des centres spécialisés avec vraiment une expertise de haut niveau. Voilà à peu près les quelques exemples que je peux vous donner aujourd'hui.
Thank you so much. And I wish we had more time so I don't have to rush everyone. I'm going to move to Faiza to quickly tell us what are some ways in which Save the Children is adapting to better support countries, prevent, prepare for, and respond to future crises.
Thank you. I'll try to keep it brief. I think some of the ways we're trying to help Somalia adapt is one, through stronger community engagement, because the stronger the link is between the government at the various level and the local communities, the better the responses and more inclusive the response. The second one is comprehensive emergency preparedness plans for the education sector, and not only at the government and ministry level, but also at the micro level, at the individual school levels. We try to invest in building the capacity of teachers and school leaders on emergency planning and response, making sure that they have the necessary skills needed. 3 is investing in the physical and technological infrastructure that the education system really needs in order for it to become more resilient. And then, of course, helping to establish more robust monitoring and evaluation frameworks so that we can better learn from the past crises and really see, how our response worked and what needs to be adapted and improved on. And finally, facilitating the exchange of knowledge and allowing Somalia to learn from the experience of others in the region and others more globally. I'll keep it at that and back to you.
Thank you so much, Faiza. That's really, really interesting. Alison, same question to you. How is the World Bank adapting to better support countries?
Sure, thanks so much. I'll also try to keep it brief. I think one of the main areas is way staffing up on EdTech. So there's a kind of a regional network of EdTech experts. This is from infrastructure to soft inputs, but just a massive amount of support that's needed to think through all kinds of different technology solutions that should accompany good quality teaching learning. So that's been enormously useful, even in terms of how to keep data secure, for example, for countries that are thinking about that. There's also, we try to partner closely with people across different sectors, not just kind of our friends that we often see in social protection and health, but also colleagues in disaster risk management, for example, right? So safe school kind of models, planning where to put schools in terms of climate change to avoid flooding, all of these critical things, and that forging partnerships like that are enormously helpful. Also seeing schools as potential, it's a built-in network of communities that already exist at the school level, but other sectors don't necessarily think of them that way. So they're critical to this disaster risk response if we're tapping into those networks. So thinking about that strategically. We support materials development all the time. It's a classic thing that we support in education projects, but we, I think pre-pandemic didn't always think of how are we going to digitize and think about these materials in the delivery in a different format? How do we take things we've used and make sure that they're friendly for different kinds of technology things? So that's a piece of planning that needs to take place from the start, right? It's not something you go in after and think about how would we use technology. And related to that, teachers, it sounds like a minor thing, but it's not. Teachers' ability to do formative assessments directly with their students is enormously useful, and building in that kind of formative assessment in multiple ways in the chain is extremely important, because in the absence of that, you just have no idea if things are working. And so being very careful about how do we have good quality structured materials, how do teachers then actually go and use them, how could they be adapted in different home contexts, things like that is really helpful. But if that kind of scaffolding of good quality doesn't exist, once the system closes, things just completely devolve and fall apart. So thinking really strategically about that strong base for teachers to have in communities. Thanks so much.
Thank you so much, Allison. I'm so glad this is being recorded so we can go back and really take note of all these great lessons. Rob, I'm going to ask you a slightly different question. You've already shared a lot from UNICEF's perspective and your own experience. Do you see areas where business as usual is continuing despite what we've learned?
I do, and again, it's really this distinction between a global conversation. So overall, globally, as an overall summary, I think unfortunately, we have reverted back to pre-pandemic overall summarizing all education. So it was not easy to do, more than we would have, I think, all collectively have liked. However, there are some amazing examples at country level that have not and are continuing those innovations, many of which the panelists have mentioned, and have transformed their education systems as a result of the accelerated changes happened in the disruptive time of the school closures, the time of COVID. I think the lesson on that is how do we all continue to, in a sense, recognize the state of learning, the state of marginalization, the disparities, and recognize the need for change and the need for new approaches. Change is not easy. It's definitely not easy in the education sector due to the history of many systems and the various stakeholders and the size and scale and the complexity. So it is not easy, recognizing that. And yet, with leadership and with commitment, those changes are absolutely possible. I think it's also seizing on these new, innovative, technology-enabled or not, opportunities. Now, for that to work, I do think they need to be, we need to introduce them in countries that are relevant to each context, and also in a way that is easy to adopt. It's not easy, that it'll still require bold decisions, but that I guess it's easy in the sense that it enables the achievement of a country's vision on education. It's not imposed from external, nor is it not seen as relevant, meaning it embeds into the objectives and goals of a country in a way that then aligns with their own sort of mission, if you'd like, on transforming their education system. Back to you, Margaret.
Thank you so much, Rob. And Martin, we started with you. We're going to end with you and let you have the last word as well. What in your, both as director of IIP and from your experience as a minister, where do we still need to do better to be able to respond to crises in an agile way, regardless of what type of crisis?
Thank you again. There is a need for system strengthening to be able to plan for building prevention, mitigation, and preparedness measures across the planning cycle. From the analysis of data to monitoring and evaluation of programs and planning implementation. A lot of coordination is needed, and we don't have in all the countries that we have been working with that kind of coordination, but a lot of coordination is needed internally of education sectors, but also, as it was mentioned before, with other sectors. We need data from education, but also data that is produced by other sectors. This type of planning is what we at IIP refer to as crisis-sensitive planning. And we think that in order to institutionalize that approach in governments, it's important to link these responses to medium and long-term strategies rather than producing responses that run in parallel paths. That will mean, for example, to include measures that help maintain access to education, For example, identifying safe site location for education facility, costing rehabilitation, or putting in place in some context contingency plans for online learning. It also requires designing measures to enhance the quality of education, such as training teachers or climate change adaptation. At the end, what countries need is to coordinate more at the level of the Ministry of Education, but also with other sectors, and with that approach to be able to strengthening the systems in order to respond to the different crises that we are facing right now.
Thank you so much, Martin, for those final words. This has been such a rich discussion, and I wish we could continue, and we don't even have time for questions. But really, it's been really interesting to listen to all of you, and I thank you so much for taking the time to join this panel and share your experiences. I'm now going to very quickly hand over to my colleague Rafael Martinez, who is the lead of education policy and planning at GPE, and she'll just provide some concluding remarks. Over to you, Rafael.
Yeah, thank you, Margarita. And I only have 3 minutes left for doing that, and that was such a rich discussion yesterday and today. So it's quite a difficult task, but thanks a lot to all of the panelists and participants for their reflections and insights. And we'll be blogging after the event. So we'll be using a lot of what you've been discussing, because really there's no time to spare in putting the lessons we talked about over the past 2 days into practice. What we were interested in with this webinar was how the sector, including GP, can better support systems to be prepared and responsive to crises, so all children keep learning. And one of the tensions that COVID-19 laid bare was that of balancing education objectives with health objectives. In a very short time after the pandemic began, schools were closed and remained closed for weeks, months, years in some cases. And we've heard during the webinar about the effects of school closure to learning outcomes and well-being. And most of us also witnessed this ourselves in our families during the pandemic. We heard it from Dawn today. The evidence is still mixed as to whether school closures had a positive impact on reducing the transmission of the virus. But we know that evidence is rather overwhelming on the negative impacts that this policy decision had on education. So now that we know this, policymakers may be better informed to balance different objectives and imperatives during future crises, so that education doesn't bear such losses. But for that, there's different ways of trying to anticipate the crisis, and the panelists have been offering different insights on how to protect and education and build systems resilience for ensuring continuity of learning. And I have retained 3 important elements that also deeply resonate with GP operating model and principles. One is partnerships, the second is planning, and the other one is evidence. Given the multitude of hazards and the ways that they affect children and families and communities, we need to recognize the value of building partnerships across sectors. Even within the education sector, partnerships are essential in ensuring that education continues, including between public and private sectors. The second one is crisis contingency planning, that is also critical to prepare and quickly respond to different disruptions. And we should look to institutionalize the lessons from the pandemic response in such plans. So there's a sort of agreement on what we would or wouldn't do again. And given the trends on climate change, crisis-sensitive education sector planning is becoming essential across most of the world. But planning wouldn't be possible without evidence. And yesterday, David from the EdTech Hub and Alex from the World Bank spoke to the need for local evidence and applied research in order to build resilience. In particular, the need to continually foster a culture of evidence-based decision-making. Data and evidence are critical if we want to continue learning and adapting, which concept is at the core of what GP operating model is. So we keep learning and adjusting, and we improve access, quality, and gender equity through building inclusive and resilient education systems. As we look Looking back over the past 4 years, what is clear is that working on one just part of the system is not sufficient to ensure resilience. Response planning need to be coupled with finance, technology with teachers who are able to use it, learning materials with consideration of the specific needs of children. Those are just examples. There were many others. Resilience starts during normal times from the connections that are strengthened between actors in the system. So strong relationships between children and teachers, between teachers and their support structure, between central level administrators and those closer to the communities, between different ministries concerned with children. All of those connections should allow the systems to mitigate the worst impacts of crisis on children, and in the best case, ensuring that learning continues. So I'm just going to conclude that we probably need to continue adopting this kind of system thinking in order to have a collective impact. And I wanted to thank all of you for joining this webinar, and again for the very rich discussion and the great insights from all of the panelists. Thank you to everyone.
Thanks, everyone.
Bye.
Thank you so much, everybody.
Merci. Merci beaucoup. Merci.
Thanks, everyone. Bye-bye.
Mm-hmm.